Hi, welcome back to the last part of this lecture. And this lecture is about compare and contrast between the depolarizing and non-depolarizing neuromuscular blockers. When we talk about the mechanism of action between non-depolarizing NMB and also depolarizing NMB drugs, when we talk about non-depolarizing, actually it's in small clinical doses, they act at the predominantly at the nicotinic receptor site to block acetylcholine, and at a higher dose, it can block pre-junctional sodium channel, thereby decreasing acetylcholine release. Because of the competitive nature of the post-synaptic blockade, the transient relief of the block can be achieved by increasing acetylcholine levels at the synaptic lab, which is the use of cholinesterase inhibitors. And for the depolarizing NMB, for the phase one, actually, the membrane is depolarized by the opening of acetylcholine receptor channel, causing the brief period of muscle fasciculation. And for the phase two, the end plate eventually repolarize, but because succinylcholine is not metabolized like acetylcholine, it continues to occupy the acetylcholine receptors to desensitize the end plate. All right. When we look at to the another differences between non-depolarizing and depolarizing NMB, these are the list of the examples of the drugs for non-depolarizing, and succinylcholine, the only depolarizing drugs that still used in clinical. And for non-depolarizing, it is reversible by anticholinesterase drugs, but for depolarizing, it is not reversible by anticholinesterase drugs. And both non-depolarizing and depolarizing NMB has a same therapeutic use. For example, as adjuvant drugs in surgical anesthesia to produce muscle relaxation. And for the adverse effects of non-depolarizing, such as for tuberculin, actually it decreases in blood pressure, and also it can cause a bronchospasm, while the adverse effects of the depolarizing as listed here. And malignant hyperthermia is different. It's very make it different with the adverse effect of non-depolarizing. Another important information that you need to look at is about reversal of neuromuscular blockade. The goal of this activity is to re-establishment of spontaneous respiration and the ability to protect airway from aspiration. And the antagonism of neuromuscular blockade, the effectiveness of anticholinesterase depends on the degree of recovery presence to the patient when they are administered. And the examples of anticholinesterase are neostigmine, peridostigmine, and also the hydrophonium. The mechanism of action of the antagonism of neuromuscular blockade activities involve the inhibiting activity of acetylcholinesterase. Therefore, more acetylcholine available at neuromuscular junction, which then compete for sites on nicotinic cholinergic receptors. And the action at muscarinic cholinergic receptors causes the bradycardia, hypersecretion, and also increased intestinal tone. The muscarinic side effects are minimized by anticholinergic agents such as atropine, scopolamine, and also glycoprolate. I think that's all for this lecture. And you also need to do a very detailed revision using textbook to get more information. And then all the best for you. Thank you.